So good afternoon, Prof Hazreen. Thank you so much, for taking the time to do this session with us. Okay, so before we start, could you briefly introduce yourself and tell us about your current role and your research background?
Oh, thank you very much. My name is Hazreen. Previously, I'm from what we call it, the Department of Social Preventive Medicine, Faculty of Medicine, University of Malaya. I'm there up until my professorship, but now I'm still honorary professor there. Currently, at the Health Sciences University based in Bournemouth. On a school, what we call it, of Health and Rehabilitation Sciences, ethics lead, and also associate professor here, focusing in dietetics.
I see. Because no, Prof, I saw you have published a lot of paper in dietetics, and also nutrition, and also public health. So, what is your research about? And then, do you have any so what are the main research questions that you are trying to answer? Maybe based on your past research projects or your current research projects.
Oh,
Yeah.
that's good because, of course, me myself, I do have my own research that I'm interested. But as you progress with research, you normally will also collaborate with others. I would like to say based on the work that I've done, my key things, I started with what we call gut health in prebiotics or microbiome, mostly in clinical applications in critical care. That is the beginning for my PhD, but that was like 20 years ago. I'm still looking to it, but I'm expanding that in a small amount. But then my bigger focus in terms of public health nutrition is looking at what we call it as adolescent cohort that is based in Malaysia. But this we initiate that back then in 2012, and then we follow through the school children, which about 1,300 of school children over the years, and we investigate a few parameters, including their dietary behaviors and some of their metabolic health. But that will be my main, but also I do have some other work that I've done either with marginalized group in terms of looking into their nutrition, or also looking into some of this implementation policy research for migrants and things like that. But that will be as an overall. Now I'm based in the UK. My focus will be slightly different, focusing on what we call it as a critical care patient survivors, focusing in nutrition.
Yeah, okay. So, Bob, so what inspired you to become interested, in this kind of research area? Maybe in the past or in the current, your current roles.
Well, sometimes when we are doing research, it's not just because we want to do research. It is something that we would like to understand more, either to answer certain questions that we couldn't find the answer from literature. Sometimes it's related to what we call it our practice, and we notice why these things is actually not working. So when I'm doing the adolescent cohort back home, we are still following them up until now. They are adults now. When I started that work, I do have a lot of questions about. We talk about obesity increasing in adulthood, but my question at that time is it starting from younger? Yes, there's enough evidence to show it from internationally, but we find it very lacking or lack of information in developing countries. In fact, when we started that cohort study, is among the first within the Southeast Asia, as long as also in Asia. The good thing is actually we want to understand, is there any things or gaps that we have been doing or we can improve from our practice in terms of policy for the nutrition, in terms of school that we can intervene. So those are the few things based on my cohort study that I'm doing. Yeah.
Yeah. So, Prof, so what are some of the bigger challenges, that you have encountered when you are conducting this kind of research, like following like the adolescents, in this cohort study?
Wow, very good question. I think with all researchers, it's all about the time and also limited resources. When I say limited resources here, it implies either in terms of time, also in terms of manpower, and also funding. So in my case, when we are when we are visiting the schools, sometimes the school can be very receptive. They are happy for us to conduct the study, but sometimes they put some sort of like a limitations. You can only be there within 4 hours, finish all data collection within that 4 hours for our 100 students. So a lot of sometimes it's also issues in terms of when we did studies related to biomarkers, you want to make sure that the blood is always stable for you to bring back to the lab to be analyzed. And if you are working or you did some study in a rural area, what would be your plan or strategy to bring that blood for analysis in the hospital? So the challenges is actually quite a bit, but if I reflected back, because of those challenges, it made me think outside the box so that I'm able to actually think what would be the best way to move forward.
Yeah. So, Prof, how do you translate your research findings into practice, policy, or benefits, for the communities and the wider public? Yeah.
Yes, so in terms of practice, if let's say we are doing research that is related to patient care, which I did last time for the IBS, one thing that we can do is actually when we advise the patient itself. So we want to see what works and what not. So in this case, we evaluated in terms of specific dietary that is suitable for IBS patient in Asia. And in fact, some of the works that have been done has now been acknowledged and cited. And soon I'm going to be with a few panels to come up with a consensus of management of IBS and dietary management for Asia Pacific. That's one. But other things that you can do is when you talk about how to put it in terms of policy, out of the words that we publish, sometimes the Ministry of Health or Ministry of Education adopted some of the work can be used in the policy that they've been developing. So out of that work that have been publishing, about 40 or 50 documents had been used as part of supporting the evidence for the policies development back home in Malaysia. But nevertheless, there are also work which I didn't highlighted because we had done the adolescent cohort study. We acknowledge the consumption of salt is actually quite high. So because of that, we had worked together with few collaborators at Queen Mary as well as from WHO. So people from Ministry of Health in Malaysia. So one of those in the food law, we managed to actually, as a team, reduce the amount of salt in soy sauce ketchup that is sold in Malaysia. So if you look into that, it varies. It can influence from policy and it can also influence an act, for example. So it is quite a wide array. And that will also influence um, at the end the main stakeholders, which is actually the public. So it is for the betterment for the public's public health, for the betterment of public health in terms of nutrition.
I see. So, Prof, I mean, so my next question is that how do you think that AI is going to change the way, we conduct our nutrition or dietetic research or even public health research in this kind of field over the next 5 to 10 years? Because AI is going to stay, right? So
Oh
nowadays
yes.
people use AI, for example, to analyze like food products, image. So what is your opinion on this?
Oh, we have to work together with AI. Whether you like it or not, you have to. So, for example, if you look back maybe 10, 15 years ago, when you're doing systematic review, you always need your 2% or 3%. But now, even though before you have your second person to go through of the literature, you can use an AI. There's so many AI to actually skim through from that thousands of papers just to focus on certain papers. That's one. But then when when you're doing or you did some data collection of a longitudinal study, you can also work with AI expert in terms of looking at longitudinal, what's the trend is going to be like. So this is something that we are currently trying to evaluate and investigate for our cohort study that is based in Malaysia. But also AI is definitely something that we should consider and think when we are interacting or educating our either public or in terms of towards our children as well as towards patient, the use of AI, sometimes they can come out with very nice infographic that you couldn't think of. And for patients, when they see that information easy to understand, it is more meaningful than us talking for half an hour. So I said, um, well, people might actually don't like it, but you have to be working together closely with AI. That's how I look into it.
Yeah. So, Prof, so I mean, like, what advice would you give to students or early career researcher who would like to work, in your research area? Because I know that you have work experience and academic leadership, in University of Malaya, in Malaysia, US, UK, and also you have been to different countries. So, how can we be as successful as you?
That's very kind of you to actually say that. I think success is because not just hard work and perseverance, it's also mentorship. It is very important if you would like to progress in research, is actually having the good mentor. Mentor doesn't have to be somebody superior. Mentor can be also within the same level, your colleagues, and also sometimes students. So a proper direction or mentorship, because in academia or in research, it used to be not say hostile, but people actually try not to, not supporting enough. Okay, so if I'm going to be a new researcher, work closely with colleagues and or superior that are happy to see you growing. So that would be my advice. And also in the research, for example, if you feel that you want, because there's a lot of works that people have done in terms of CVD risk and diet in terms of more how do I say, developed countries, okay, or higher income countries. But if you would like to know more in from the lower middle income countries, get connected, because we do have a network that we can collaborate. So it is more towards collaboration, and having that mentoring and collaboration will bring you further.
Okay,
Mm.
Prof. So my last question, what research questions or projects would you like to explore in the future? So it can be, I mean, like, anything that you want to do, or yeah, yeah.
I actually, that's a very good question. There are, in fact, and not anything that I want to do, is already three things that is already in the pipeline. So one is actually because I said with our adolescent cohort, we are following them now as a young adults. So we want to see how their nutritional and health status to begin with. So potentially with this amount of information data, we try to learn and use AI as well to predict some sort of a modeling. That's one. That is also maybe potentially part of your expertise. And then another one is actually looking at, while I'm in the UK, so I did mention in from my beginning, I worked closely before in gut microbiome and nutrition for critical care patients. But now I notice those who are survivors of the critical care, they might not having adequate nutrition due to various reasons. Okay, so I now would like to investigate how can we empower the nutrition for these critical care patients or survivors, means that they discharged from the hospitals. That is something that is my interest and ongoing. I'm working with Wessex Health Partners and few others. Um, yeah, so I did mention about the AI just now, a cohort, and also for in terms of food, I'm looking into in terms of based on the data that we have in terms of food diversity, also in terms of UPF that been consumed back home from our cohort that is in the pipeline. So those are the things that I can cope at the moment. So
Mm.
yes.
Hey, Prof, maybe one more question. I mean, this is just my personal interest because we are from, let's say, from Malaysia, and then now we all are working in the UK. So do you have any tips, on, let's say, for example, like, for those who are new to the UK, and like this, early career researcher, how do we navigate around, okay, like the UK higher education? I mean, like, what are the things that we need to focus on? Let's say when we first start our job in the UK, should we focus
Okay.
more on the teaching and learning or research? Yeah.
That's a very good question. There's no right or wrong answer to that because it all coming back to your job description that we are working on. Majority of it now is based on teaching, so we need to make sure that it's actually based on teaching. But sometimes we can be innovative with this, and uh, and look at what things are working and what are not, and then you can actually share your experience. So I'm just sharing my experience. For example, when I started working together this program, I'm not sure whether I'm doing it right or wrong, but at the same time, I do have my colleagues, and we learn from each other. Might not be from dietetics per se, but allied health professionals. For example, they are running clinics. How do they actually make it work for their students? So that can be some sort like a more innovative pedagogical approach, so that the student can learn via experiential learning, and they can do some reflective. So coming back to your questions just now, it is also look at opportunities to network, uh, even though sometimes it is very mundane and busy with just teaching. You need to allocate a little bit of time, like what you're doing right now, getting to know the tips and then get to know the link. So I might not be the best person for that, but I'm happy to link you up with someone else who might be in your interest in learning and technology, because you see, learning technology cannot be separated with AI. Okay, so this is something, and maybe there is something that you can navigate further in terms of nutrition and education and things like that. So I would say another thing I would say, one thing good if you are in the UK or Europe, there's a lot of early career research network that they encourage to link in, because over here what is important is to ask people. Don't expect for people to understand us, but you need to ask, because they are more than happy to actually help if they know what to help.
Yeah,
if you
that's
don't, if you don't, if you don't ask, how do we know to help? But I have to admit, sometimes get surrounded by positive colleagues, and you can learn a lot from each other. That's how I can see
mm,
it. Yeah,
yeah. Thank you, Prof. I think that's all, for our session. I'll just stop the recording now. Thank you so much
brilliant.
for your time. Okay.
Thank you. You're welcome.